Hello, and thanks for watching the Friends of the Farm lecture series. Each session is designed to deliver a small and in depth dose of cannabis education. My name is Candace Hawes, and I want to thank all of our viewers and customers from pharmacy, pottery, the Natural Healing Center, as well as all of our friends watching from around the world. We have other incredible webinars on terpenes, formulation, sustainability, medical uses, history, travel, and cannabinoids. So please make sure to hit subscribe and get notified when we post future cannabis content. As cannabis consumers, it's important to know how long term cannabis use affects dental health. So I'm pleased to have Dr. Anna Paula Federighi with us here today. Surprisingly, cannabis and dental health is not discussed far often enough. I often get asked, how long should one wait after extractions to use inhaled cannabis? Which method is least harmful to my teeth, and other questions along that line. To educate us on this topic is my friend and our friend of the Friends of the Farm Cannabis Lecture Series, Dr. Anna Paula Federighi, DDS. She's, like I said, a friend of the Farm Lecture Series. She's been watching for years. She's also a cannabis educator. She's been working in this field, which I feel like there's far not enough dentists working in this field. So I'm very excited about what she's been doing. She has a wonderful presentation for us today. She's going to talk about common issues that consumers face, the benefits of cannabis for dental conditions, the effects of different delivery methods, and also take our live viewer questions at the end. Dr. Anna has been a dentist for over 36 years, specializing in endodontics, occupational dentistry, and cannabis sativa. She's trained in laser therapy, inhalation analgesia, and dental sleep medicine. She's currently pursuing her healer certification with Dr. Dustin Sulak. That's an amazing program. That's really cool. She's also a member of the Society of Cannabis Clinicians, another amazing organization, and the Pharmacists Cannabis Coalition in California. With an integrative and humanized clinical approach, Dr. Anna Paula is recognized for her creative and didactic style, where she translates scientific concepts into accessible language for patients to understand and implement her guidance. Her journey into phytocannabinoid therapy began in 2021 as a cannabis patient experiencing relief from pain and insomnia. Anna is passionate about educating individuals and healthcare professionals on the impact of cannabis on people's life and quality of medicine and quality of life. With a natural talent for education, she believes that every healthcare professional is, and above all, an educator, which I also agree to. Beyond patient care, she is dedicated to educating individuals and healthcare professionals about the impact of cannabis on life and quality of life, on health and quality of life. When not discussing cannabis, Anna Paula enjoys road cycling, playing the piano, and exploring new cultures around the world.
Yeah, different skills.
Yes. I'm so excited to have you with us. Thank you so much, Anna Paula, for being with us today.
Thank you, Candice, and thank everyone for having me in this webinar. As you introduced me, I'm a Brazilian dentist. I worked in clinical care in São Paulo as an endodontist for over than 30 years. And when I moved to California in the end of 2020, I began to study cannabis because I seeking for some relief for my pain and insomnia, and as you describe it, and I find some relief in cannabis. In Brazil, for those who don't know, in Brazil, doctors and medical doctors and dentists can prescribe and follow up cannabis treatment with their patients. I
So
see
cool.
that it is a it's a step. It's a big step. For those, as I see patients virtually and sometimes in person, and I travel there. And I like to describe myself as a person that helps people to choose their treatment as a cannabis advisor all around the world because telemedicine changed everything for caring people. And I truly believe in telemedicine because everyone can access knowledge and care. Even from a distance, we can be human and taking care of people with all the attention they deserve. Well, probably some of you have heard about endocannabinoid system, which is responsible for maintaining the balance of the other systems in your body. And I want to go deeper into endocannabinoid system. Uh, to cover topics that are brought to you tonight, specific topics. But I know that on Friends of the Farm YouTube channel, there's a video by Dr. Michelle Ross
Yep.
talking about fibromyalgia and cannabis. And I remember it was about 2 years ago. It's very enlightening. And if you know somebody that is facing problems like fibromyalgia, I really recommended this video. As introduction, I just highlight one key point of independent medicine. When you get old, when you get sick, our body becomes imbalanced. And cannabis can help restore this balance somehow because cannabis reduces pain, improves sleep, reduces anxiety. Cannabis can balance our mood, among other, I don't know how many properties she has. But first of all, I am a cannabis patient. So in 2021, noticing the positive effects that cannabis had on me, I began to study cannabis and became what I am today. Starting I started studying the benefits that cannabis can bring to oral health also. And because cannabis has everything to do with the mouth, and mouth has everything to do with in how we communicated with people, I will talk something about how the communication should be between patients and doctors when the subject is cannabis. Yeah, some old folks here in this picture. I used to start a presentation, remember that even though you're not a dentist, many people have long-term relationships with their dentists. We have patients, as you see, little as babies, and they became teenagers, whitening their teeth or having their wisdom tooth out, and we have seniors taking care of their oral health. And with all of them, we need to build a sincere and honest relationship and communication. And that's why we are here today. We are going to talk about how we can build this communication between doctors and patients, especially when discussing cannabis. So let's get started. Well, for those who don't know, a doctor's office is like a Las Vegas. What happens there stays there. Your medical history, your records, your text conversations, they are all confidential. They only share with a court order. And one thing that always gets my attention when they started studying cannabis and elaborated questionnaire questions to do to investigate the medical history of the patient. We don't talk about cannabis in dental office. Even though those informations are so protected by law, why does the word marijuana, for example, almost never appear in medical history forms? And this is also a question among patients. These are some questions, discussion that I found on the internet is like, if your doctor asks you if you smoke, he's talking about cigarettes or vapes or marijuana. I realize that people don't know how to approach their doctors about cannabis.
And with dentists, it's pretty important because, smoke is going into your mouth,
Yes,
into your teeth. You need to be on it.
yeah. If you know if the dentists know what to expect for a cannabis user, you can spotting signs. You can see it, and you can try to open a conversation with the patient. This is the communication is very important because you are taking care of the person, the whole body actually. Well, because of I was talking about why people don't talk about marijuana in dental office, probably because of years of prohibition. cannabis users were associated with danger, with poor hygiene, with lack of personal or health care for decades. So this conversation is stuck from that time. And as clinicians, as we are talking right now, we must understand that many substances can impact oral health. When you see signs of regular cannabis use, you can educate your patient and give them the most effective and safe treatment. When using cannabis, the most common oral side effect is dry mouth, also known as xerostomia. And talking about xerostomia, I will have now a quick break for my water and for playing this video. Yeah. I can't see the bar. Can you change for me? Can see, please? A little joke. I picked this video on Instagram. Andrew Escott is a works with cannabis and works with social media too. He's a very fancy guy. And it's a joke. No, obviously, this is a joke because
Don't do it at your own
nobody
dentist office.
nobody should wear a mask above the nose, and nobody should vapes inside the dental office, or should not. I don't know. Because we talk about decreased saliva production, let's talk about why saliva is so important. The baby is drooling. Well, we produce between 1 and 1.5 saliva per day, made by the salivary glands. Saliva contains enzymes, minerals, and amino acids. And saliva plays an important role in oral health because it lubricates the mouth. Saliva aids digestion and neutralizes acids from bacteria, helping to prevent infections. So saliva is one of the key components of the oral system. And that's why saliva is very important for the balance of the oral microbiome. Next, I will bring the three topics that connect cannabis and oral health. The first one is back into the guy, xerostomia. When someone uses cannabis by smoking or vaping or anything with high THC levels, THC binds to CB1 receptors into the salivary producing glands. This binding signals the glands to reduce saliva production. It's as if THC joins CB1 receptor and they command, hey salivary glands, stopping producing saliva right now. The result is dry mouth. And less saliva can cause dry and sticky feeling in the mouth. Difficult speaking. I am facing this right now because long talkings cause dry mouth. Swallowing and tasting food. Burning and tingling sensation in the mouth and tongue. Dry, cracked lips, bad breath. Increased risk of cavities and gum diseases, and more frequent oral infections. As you see, this lack of saliva can affect oral health and general being. Of course, that other factors can cause red mouth. Cannabis is not the only guilt on xerostomia. Medications, autoimmune diseases, head and neck radiation therapy, stress, dehydration, smoking, alcohol, caffeine can cause dry mouth. Keep in mind, almost all medications affect saliva production in a bad way. And we know that the treatment depends on the cause. We don't, if you don't know what is causing dry mouth, um, there are some guidelines for dry mouth that can help in any situation. The first one is hydration. Hydration, proper hydration will relieve the symptoms, and we are talking about water.
Good old water.
Yeah, it's a pitch for the water because
Hmm.
alcoholic beverages, sugary drinks, and caffeine can worsen dryness. Um, you can see, for example, artificial saliva in drugstores. You can find it in drops, spray, or gels. But artificial saliva is considered a palliative treatment. It's only recommended when nothing else is helping the patient. Some people find some relief in sugarless gums and chewing crunchy fruits or vegetables. Health food, like apples and carrots, this stimulated the saliva production. Here is at the end something special when dry mouth is caused by THC. You can find some relief with cannabis. Exactly what we heard. CBD can help dry mouth caused by THC. Oh, it's funny because the same plant has some effects in different ways, right? What happens is that when CBD binds to the receptor into the salivary glands, CBD won't let THC bind anymore, and THC was like stuck with a command. Remember, stop salivary glands, it won't happen. So this is what we call allosteric modulation of CBD. CBD has this property to modulate a lot of not bad effects because it's bad depending what you expect from that condition, but some not really like it unlikely effects of THC. The second, you want to say something?
Oh no, I was just saying I found this so interesting because I always thought of like dry mouth, cotton mouth is just like one of the side effects, and you just like kind of grin and bear and like work through. I never really understood that there was like negative health benefits associated with it, and that it's one of the side effects that you really need to treat and stay on top of. And like after reviewing the slides, and I even put this in the notes, I found this like so very interesting, and like I'm gonna be like really more on top of like dry mouth and like not letting it go, not just being like, oh, just I'll get a water and like a little bit. Like I'm gonna have water with me all the time, and like as soon as I feel
Yeah.
dry mouth, like on top of it, making sure I drink water, making sure people always have water, because it's not just like a side effect. Like, oh, I'll deal with it. Like stay hydrated is very important. So I'm
Yes,
really
it's very
glad that
important. It's very important. Yeah. We have to marry our bottle of water.
yes.
Take that everywhere.
And the CBD part too is very interesting, and that helps mitigate some of the bad
Yeah,
effects
we
of
can
dry
we
mouth.
can we can we can try some strategies. If you're having a hard time with dry mouth, for example, we can take a oil rich in CBD, for example, to minimize this dry mouth effect on the of the THC. This is it's like we can use it strategically all the compounds of cannabis.
Very cool.
Um, the second topic is the effects of cannabis on soft tissues. In the mouth, we have hard tissues, that is the teeth and bones, and soft tissues, that is gums, oral and lingual mucosa, and the lips. Many people and their dentists haven't thought about how smoking anything can increase the risk of gum disease. The smoke irritates your gums, making them red, swollen, and bleed easily if not treated. Chronic gingivitis can lead to a periodontal disease. This picture shows the black and white picture that is in the background. I put in black and white just to not shock, because it's not a very beautiful image to see. But you can notice how chronic gingivitis, a gum with chronic gingivitis look like. She's puffy, red. The gums do not improve with brushing, flossing, or even having a cleaning done in dental office. And the risk is the chronic gingivitis can lead to a periodontal disease. This is what happens when the inflammation damage the bone around the teeth, which can eventually cause tooth loss. Smoking for a long time also can make the mouth liner thicker and wider, call it leukoplakia, which is a precancerous disease. Another bad effect that the smoking can cause on oral mucosa is lip burns. Inhale hot smoke when you're smoking. You can burn your lips, your tongue, because if the smoke is hotter than you think, probably you have some burning inside your mouth. And even when you exhale, imagine that the heat needs to escape somewhere, and you can cause burn marks in the corner of your lips. In case of something like that happens, how to care or prevent it? CBD again, CBD tinctures. This good for everything, just to put in your mouth. You're having zillions of benefits in your body. But we also have toothpaste and mouthwashes with CBD in the market that will help to take care of your gums. They have been around in the market for a while, but I saw this been saying is just found online, I guess. I never saw in the drugstore something with real CBD. We can find hemp products, healthy oral products with hemp products, but not CBD. Just find only online. One thing that the taste is not so good, but it's very effective is copaiba oil. Is another option. Copaiba oil is rich in beta-caryophyllene. That's a terpene that can calm the gums and oral mucosa. And the use of glass tips in your cigarette. Using glass tips when smoking can reduce tar intake, but remember, burning all the paper also creates tar. Tar is a mix of chemicals released when any organic plant material is burned. When smoking, harmful chemicals are released and can be inhaled with the smoke. And this is also known to cause cancer. I'm seeing the poll question here, trying to escape from that to change the slide. The last topic, the third and last topic that I'm talking about is about cannabis and anesthesia. We all know that, unfortunately, anesthetic is a part of dental routine and nobody really likes it. Many people hate, are afraid of anesthesia, or just get anxious just to think about it. And because of that, it might be tempting to use cannabis before a procedure just to chill out. But this is not a great combo because it might seem like they match, it's a match made in heaven, but we have to step back and let's talk about. There are some papers declaring that patients need more anesthesia, something like 3 times more. Those papers also declare that patients report more pain, discomfort, but we have to analyze with a extra attention because most of those studies refer to anesthesia in major surgeries done in hospital. They are not referring to the same amount that a dentist use on a dental office. Even so, Paula, Anna here, you told me that That is a step behind with anesthesia. Before dental procedure, I'm going to explain that because the problem is not the anesthesia at all. Because we also have studies that said that there is not a significant difference in the efficacy on the onset time or the duration of the anesthetics when combined it with cannabis, but we need to pay attention to this point because the problem is not the anesthesia or the cannabis, it's the condition of the patient. The dental professional know that that patient is a regular cannabis user. The dentist should focus on the current condition of that patient that day. Is he anxious? Is he paranoid? Is he having fast heartbeat? Remember when I talk about the importance of knowing your patient well. If you open the conversation for cannabis in your practice, probably we will improve the conversation and you can know your patient better. So in these cases, just ask the patient because he simply don't know. He will not ask about it.
Yeah.
And we recommended that advise the patient to stop using for 72 hours before the procedure. About anesthetics, again, some anesthetics contain epinephrine, and we as dentists must have an exhortation with that because epinephrine is a substance that narrows blood vessels, reducing the blood flow, decreasing bleeding during surgical procedures. This is called vasoconstriction. Now, THC, on the flip side,
Yep.
open blood
Yep.
vessels.
It's a vasodilator.
Yeah, making the blood flow. This is vasodilation. And mixing epinephrine with THC makes your body vessels get conflicting messages like
Ah,
tighten up, open up at the same time. And this can mess the regulation of the blood flow and can hike up to risks like a high blood pressure or heart issues in your dental office.
yeah, that's not
And
something you want to deal with.
yeah, we have to know everything about it, the
Hmm.
patient. It's like a FBI questionnaire. I come back to this slide to remember that there are some papers relating that patients need three times more because three times more anesthesia, they will face more pain, need more painkillers because of this situation here. Dentists can perform major surgeries like orthodontic surgeries. And this is when we really need to be careful with anesthesia. This case is one of those studies because combining sedation, anesthesia, and cannabis, they all interact with the central nervous system and can lead to unexpected problems during surgeries or right after the third surgery. More, oh, my zero story. I choose four main methods of medicinal cannabis delivery, and I will talk about a little about each one. And the first one, of course, is the most famous one. And from a dental perspective, is the one with the highest risk. You know that famous saying, where there's smoke, there's fire? That in this situation make perfect sense when talk about smoking anything and oral health. But smoking cannabis can quickly deliver cannabinoids to the target area. This is indiscussable. The onset time is very quickly, which explain why smoking is very effective and popular in cases of chronic pain, oncologic pain, and nausea caused by cancer treatments. But just as quickly the effect begins, it also fades away. So think about it. you're in pain, and you will need more in a short time, and we have to deal with the risk of intoxication. And there are also problems concerning the oral health. If you're smoking and having some minor surgeries that is performed in a dental office, because smoking can decrease osseointegration. What does that mean? Imagine you had an implant or any surgery involving bone, and smoking will reduce the bone cells' ability to recover and heal. Smoking will decrease the immune response and make your body more susceptible to infections, mainly when you're recovering from a surgery, a dental surgery. Smoking interferes with tissue healing because the healing process will be very, very slow because the decrease of the blood flow. I need to explain something about the blood flow and healing. We have more blood in tissues when tissues are healing. This is a good thing. The tissue need all that blood for healing better and healing faster. When you smoke, less blood reaches the tissues that need that blood for the healing, and the healing time really slow down. This can lead to a decrease of the inflammatory response. After procedures, small inflammations are expected. This is part of the healing process, and smoking can make this process difficult, slowing down the healing speed and increase the chance of the surgical failure. I have seen about 10 years ago. It was after an implant surgery. The patient has open wound days, like 4 or 5 days after the surgery, because she was a smoking patient, and she lost that implant like in 1 or 2 weeks. It was a new implant, and over the time, in the long term, she lost also other implants and teeth. Um, the last one is smoking alters the oral microbiome, allowing bad bacteria to grow, changing the balance of oral cavity. I'm not talking about marijuana only. All cigarettes, any kind of combustion can cause these problems. This is a very dentist speaking. In summary, health teeth and health implants, smoking can cause irreversible damage. And then we can tell me, okay, I'm convinced. I don't want to smoke every day. I don't want to manage my pain or my insomnia with smoking. So how can I keep using cannabis with fast effects and also take care of my dental health? Are there other form less harmful than smoking? And yes, that is. Let's talk about vapes. Vapes is when you inhale and exhale vapor from an electronic device. I have some here to show to the audience, like a vape pen, which heats a liquid, a solid extracted, or a dried flower. Vaping cannabis is considered to be safer than smoking because vapes heats up the product, but below the turning point, the compounds don't burn. And there are different types of cannabis vaporizers. We can found that disposable or refillable. We can use that with dry herbs, oil, or wax. And the $1 million question: is it safe? And it depends. There are few studies on vaping, but scientists and policymakers suggested that can reduce the exposure to toxins compared to smoking. But the fact is, there's no combustion. So the harmful is lower. That makes vaping, for example, a potential harm reduction method for compulsive cannabis smokers. Or for those that want to, oh, I don't want my, I don't want anymore all those bad effects causing on my health. The main thing we should concern about it of vaping is the quality of the product. Both device and the substance you put inside or come inside with the vape that you bought. My reminder is choose a legal and fully tested product. A reliable product will give you lab results showing that it's free of metals, of pesticides, or any other harmful compounds. Another thing to keep in mind is the risk of EVALI. EVALI stands for e-cigarette or vaping use associated with lung injury. A brief story with EVALI is during, for a coincidence, the COVID year 2019, a growing number of severe lung illnesses cases were related to use e-cigarettes and vaping products. Researchers are still working in this disease, but one thing they found, I guess in 2020, that EVALI was associated with a chemical called vitamin E acetate. It's a chemical. So be sure to buy a safe oil and a safe pre-filled vape because those are the risks. Well, let's talk about the difference. I have two here. I guess you can see. This is about dry herbs, vapes, and oil. One advantage of dry herb vapes is that you almost will experience all the things with the plant. You need to grind, you need to put the herbs inside the chamber. Then after you need to cleaning, they work by heating the cannabis flower to active the compounds without burning the plant. You can adjust the temperature, and it's a different sensation when you use a vapor from smoking. This means that basically that you enjoy all the benefits of cannabis without inhaling smoke, which can be harsh on your lungs and your oral tissues too. They produce less odor, it's super discreet, so you don't have to worry about the smell or bothering your neighbor, for example. On the other hand, oil vaporizers are generally more convenient and easy to use. This is a pre-filled and disposable one. Probably, I don't know if you can see the oil is inside. You don't have to grinding or cleaning. There's no preparation. It's a on the go and more easily vape. You don't need to clean the chamber. Instead, they use a pre-filled. This is a pre-filled cartridge, or that one with tank oils with oil concentrate. Is also odorless, super discreet because super small, and the vapor dissipates very quickly. For those who love that big cloud, oil vapors produce more vapor than dry herb vaporizers because the oil is more concentrated. And this is a heads up because they are more potent too. So you can get a much stronger high with less product. And take care because more potence can be a risk of intoxication. Um, let's talk about, I think is the most popular it's not the favorite. The favorite I leave to the last one. But tinctures are the most popular when you are talking about medicinal cannabis. The oral cavity is an easy site for medication administration. Since you're a kid, you are having uh, medication through our mouth, and when we place oil under the tongue, the blood vessels in the mucosa absorb the components directly, almost direct to the bloodstream, bypassing a great part of the digestive process. This means that cannabinoids reach the target faster, and the effect can last longer. It's not as fast as when you inhale, but this method is known as sublingual administration. It's super acceptable to patients because it's quite discreet. It's much more discreet than a vape or a dry herb vape, for example. Um, that explains why tinctures are so popular.
A
The
lot of
next
people
one.
too using cannabis for like the first time, I think, feel more comfortable using a tincture as opposed to like starting with an inhalation method. Like, you know, an 80-year-old senior is not going to start using cannabis for the first time in an inhalation method. You know, they feel more comfortable to get tincture like that. So
Yeah, yeah,
I
yeah.
agree.
It's a process. It's a
Hmm.
process. Now you can try, and you feel more confident with your treatment, and you learn more because the patient learn about cannabis, and he once he get in that journey, it's never endless. It's
Yeah, and
a
try to
beautiful
prevent.
journey.
But this is usually where
Um,
most people start on their medical journey as well. I agree.
yeah. Um, back to the mouth, or I don't know if I have to say back because I'm saying everything about a mouth and oral cavity all the time. But think with me, all the things are happening inside the mouth, where other substances are also being placed. We don't put only oil, cannabis oil, on your tongue. You put food, you put toothpastes, you put mouthwashes, candies, for example. And how can you imagine there are some interactions between those things that you put in your mouth? Let's start with food. How food can helps your cannabinoid treatment. Um, think that the presence of fats can affect how medications are absorbed. So when you're going to take your oil, remember to take it shortly after a meal, preferable with health fats such as avocado, coconut, salmon, and even hemp seeds, for example. You can have a dessert and put some hemp seeds together. That will be perfect. Another thing that we put in your mouth like every day is toothpaste or any other oral products. Some factors to consider with toothpaste. Let's think about the day of the patient. After meal, we brush our teeth and please be with me, everybody brushing your teeth after their meal. And now you're using cannabis, tinctures, the cannabis oil, and now you have a meal and your oil, and your dentist is going to say to you, wait after uh, at least 50 minutes after your meal, after your oil, to brush your teeth. There's another step. And there is some strategies if you need to brush your teeth and run for your work or something. You can manage that very easy. Um, about the toothpaste, because why we have to wait for 15 minutes, at least 15 minutes? Toothpaste have thickeners and detergents that can create a layer in the oral mucosa. It makes a barrier and makes harder for the oil to get absorbed. They also can change the saliva pH and affect how well medications like cannabis oil are absorbed. And the taste. toothpastes and taste. Well, they always change everything that you eat right after brushing your teeth,
Yeah.
including tinctures, including tinctures. So some mixing of tinctures and toothpastes, and also the situation of the oral cavity of the patient can become uncomfortable for some patients and making difficult to hold the medication under the tongue. And one last consideration, if you're a fluoride guy or a not fluoride guy in toothpastes, doesn't matter because fluoride doesn't impact how well cannabis oil will work. And
I was gonna say
needed
one
to,
more on the same line. People have asked me how long they should wait before like taking a drink of water after taking a tincture. Do you have any feedback on that? Like after applying like a tincture, how long they should like let it sit like on their tongue before they take a glass of like drink a glass of water? Because sometimes it
I,
doesn't taste the best to
I
them, you
guess
know.
I'm not 100% sure,
Yeah, I've
but
never
I
really
think
heard any like
because
equivocal answer.
water and oil are like enemies. They don't mix together. I guess it won't affect it. The principle of the toothpaste is because of the foam, they
Yeah.
degrade the molecules of amino acids and acid grasses. So I guess there is no reason for stop so much for drinking a glass of water, for
So
example.
water would be okay, just nothing abrasive like
Mm-hmm.
toothpaste would be, wait longer on the toothpaste, but water would be okay like after
Yeah.
like a minute or
Mm-hmm.
so if the taste is,
Mm-hmm.
really
Mm-hmm.
off-putting to somebody. Okay.
Okay. And I'd like to finish this slide talking about a certain type of oil that offers better absorption. I think I have it here. I don't know where. I guess. I don't. It's nano CBD. We can find tinctures with nano emulsion of CBD. This means that CBD is mixed with stabilizers to keep the particles very small. This improves the absorption, allowing that enter even faster into the bloodstream and reach the target more quickly. And the compound remains stable for longer. You don't have to wait along under your tongue. Nanoparticles can offer a faster effect. In these tinctures, the cannabinoid molecule stays the same size, but he gets a coating, protective coating, making easier to mix with liquids like water and juice. And this can be very helpful for patients that can hold the oil under the tongue.
Hmm.
Now we're going to not the popular, but the favorite one. That's why I let edibles for the end of the presentation. Edibles have a strong presence in the market, and there is a reason for that. Almost every company of medicinal cannabis products has their own version of gummies. They offer a taster way to take care of your health, and the effects last longer. There's a couple of facts with gummies, gum facts, let's say that. When ingested, cannabinoids are metabolized by the liver, and because of that, takes longer to effects to be felt. And most people don't know that. Imagine the situation because you're not feeling the effect and it's taking a while to be felt. You eat a gummy, then you eat another gummy and another gummy. And let me here. And there is a great risk of intoxication because of that. The another gummy fact is that finding the right dose. We most of people know that we can dose our cannabis slowly and with a gummy. That can be challenging. So my advice is, if you're new to gummies or edibles, if you're trying a different brand or if you don't know how that brownie was baked, start low. It's hard to tell if the amount, the cannabinoids that is present in their gummy or in that snack is too high or too low, because this, imagine that slow absorption, long lasting effects, and the dosage that you don't know how much to take it, the risk, that is the risk of intoxication. Another key point with gummies is about their sugar content. This is a great discussion between dentists and between any other dental professionals, because people say, "Oh, I like gummy, but gummy has sugar, and sugar is not good for teeth." And from a dietary view, they have the same risk as any other sugary food. So brush your teeth after having gummies is the opposite of the tinctures, just because of that. And remember to brush your teeth again after eating anything if you get munchies because of cannabis. Remember that cannabis can cause dry mouth, and THC makes you hungry and craving for carbs. And dry mouth combined with sugar and munchies, plus the fact that almost no one brushed their teeth right after eating something, can lead to a tooth decay. And what about the sugar in gummies? Let's discuss a little bit of that. Almost all gummies contain at least 2 grams of sugar, which is the same amount as one Hershey's Kiss. 2 grams may sound not much, but we talk about homeostasis and endocannabinoid system, we're mainly talking about health lifestyle, where sugar doesn't fit at all. So why medicinal gummies have sugar? Um, the companies explain that sugar masks the taste of the cannabis extracts and prevents them to sticking. And they mostly use sugar or starches for this, and we hope, who knows, soon in the near future, for a healthier option for our edible fans. So after a gummy, a candy, or a munchie, remember to brush your teeth. And to finish, I like to tell that it's fact that cannabis change the oral microbiome, and just like the gut, they are all connected: the brain, the mouth, and the gut. Remember that a balanced biome can fight off any external interference. But if your biome is not healthy, the mouth and the body are vulnerable to diseases. And what we want a balance in the endocannabinoid system to keep your body and our health working well. And before really finish, I'm going to do the last slide. I want to highlight that beyond today's discussion, cannabis offers a lot of benefits for oral health conditions, and there are safer ways to consume cannabis. I hope to come back here another day in the near future and to talk about all of them, from bruxism to bone regeneration. There are a lot of benefits that cannabis can offer to all of us.
Yeah, I would. I really, really enjoyed your presentation, and we would love to have you back. This has been really enlightening, and I know like a lot of people are really excited about this topic because it's not something that's talked about enough. And I love what you talked about at the end, that all of our body systems are connected, and people can't just treat the body with just cannabis, with just pills, with just this or that. If you have to complete or treat your whole body, it's body, mind, spirit. Every part of your body. It's what you put into your body. It's how you treat your dental health. It's all of it is combined. Your exercise, your mental health, everything. So
Yeah,
it's so
exactly.
important, all these
Exactly.
things.
Mhm.
Yeah, so it's
Because
so
you,
important that
you,
we
can,
cover
you
all
can
of it.
cover all those things to have a great life.
Yeah, definitely. So this has been very, very helpful. Do you have a couple of minutes just for me to give you to run a couple questions by that we had come through from the audience? Okay, perfect. So I had somebody that asked when we talked about stopping medications pre-surgery and taking anesthesia, and you said to stop using THC about 72 hours pre-surgery. Should somebody also abstain from CBD as well and other cannabinoids, or what were you mainly talking about THC?
I mainly talk about THC. CBD is relaxing, is also the effects of in this science is very welcome in a dental procedure. The great problem with anesthesia is THC.
Okay, perfect. That's really helpful. And then, is there any dental schools that are teaching about the endocannabinoid system? Because I know it's very few, even on the medical school side. And I was wondering, dental school wide, if there's any that are touching on that yet.
I don't know how it's happening. That's a great question because this is a big discussion in Brazil too. I don't know what's happening here in US, but first of all, we need to understand that in the endocannabinoid system wasn't just invented.
No.
Uh, in the first moment, we were going to say, well, where they come from with another system after 21st century, right? Surprisingly, they have always existed, and but just had been studied since in the 60s. Most medical and dental school are incorporating cannabis somehow, and also the study of the endocannabinoid system into professional training or specific classes or optional classes. However, I know that many universities are really focuses on researching cannabis and the potential as a therapy. Uh, all around the world, prohibition delayed our access to this knowledge for a while. But one day, I hope we will also have cannabis in schools. I hope like the digestive system
Yeah.
or nervous system.
Yeah, when they learn about all the important major body systems and how they all play together. And yeah, it'll be like one of those majors that's covered. And we will one day. We definitely will, especially with, what we see happening, in the United States, and then that will like carry on to other countries. Give us 10 years, because what we've seen just happen in the last, 5 years
Ah,
is remarkable. So
we're praying for that.
yes, yes. Another thing, and we did kind of touch on this, but like dry socket is a real thing. People get extractions, and
Mhm.
people are advised, do not smoke cigarettes, cannabis, this, that. Generally, what is advised, after people, get an extraction? How long should they definitely abstain from any kind of smoke going in their mouth
Um,
after having an extraction?
Longer, yeah, great question because this is a question that patients that smoke, it's the first question, I guess.
Yes,
How long
yes, that's the
have
first
you
thing you
been
want to know.
going? Yeah. Longer you can get away of cigarette, longer, more successful your surgery will have. We ask for, it depends on the patient. You have to know another things about that, but wait for complete healing. Wait for complete healing.
So like the wound has healed over. There's
Yeah. No chance for, no risks for anything happen.
yeah, and believe me, patients will be sorry. It's not something that you want to risk. It's major.
And they need to be aware of that. This is
Yeah.
important.
Yeah. And then someone had asked me too that they had seen some research about CBD being like an antibacterial. Have you seen that research? Are you familiar with that as well?
Yeah. I have a presentation. It is in Portuguese, but we can adapt it to English as well. I am. There is a lot of studies about that. CBD and CBG, the cannabigerol, is also very effective against a bacteria. But most of studies that I saw, like the anesthesia, was related with superbacteria in the hospital. But we not deny they have an antibacterial effect on our body. And I had been heard is anecdotal, is not scientific. I didn't read anything about but I heard that people are saying that just because you use the oil under the tongue, the tartar build up less in that region, behind those lower.
There's less infection in that area where you put the drops.
Yeah, you cleaning your teeth and the cleaning lasts longer.
That's good. That was kind of like what my next question was, is that if that you had seen, heard any research about, areas where people apply tinctures, if there's like, it helps inflammation, helps, and then you kind of talked about it, there's, less, I guess,
Mm-hmm.
infection, helps
Mm-hmm.
with, the cleanings last a little bit longer. Because I think that could be really interesting too, moving forward
Yeah.
in the dental field as well. Um,
Mm-hmm. I have
yeah.
a patient that made it's not a made in a hospital, but it was a big surgery with implants. He has my father. He has 85 years. He's diabetic, but he's very well. And he made the surgery on a Friday morning, and he was like walking around the city on morning, Sunday morning. So 3 days for an 85 years patient. Uh, Modulated with the system, endocannabinoid stimulated. He was taking more cannabinoids before and after the surgery. So I can see this. Okay, he's a good guy, but cannabis is even better.
That's cool. That's really cool. Yeah, there's so much that can be gained from cannabis in this field, and it really hasn't been tapped into. So, really exciting to see that you're getting involved in this, and I really think that's really cool that Brazil has allowed, dentists as well as medical doctors
Mm-hmm.
to advise patients and allow them to use it because it has great benefits for them. So, I really enjoyed this presentation. Thank you so much for sharing your knowledge and for being a friend of the farm. And
I,
yeah,
I have a good time. I was kind of nervous, but 5 minutes I was super relaxed. Super enjoying being here today with you guys. Thanks to everyone who attended. I know we have people from Brazil watching us. It's quite late there. Thanks for opening your heart, your ears, your mind. If you learn something, don't be shy to share. Sharing good things, good ideas, good vibes is also caring, and we
yeah,
need to care about people. Thank
yeah,
you so much.
yes, definitely. And we look forward to having you back. We already talked about a couple things that maybe we could have you back and talk about. I love working with you. Thank you again, Dr.
Thank
Anna
you,
Paula Federighi. Um,
Federighi.
Thank you.
Nice,
And
so nice.
yeah, and thank you everybody for watching today and joining us from all around the world. This has been another wonderful edition of the Friends of the Farm lecture series. I hope that we were able to share some information today that will help you all become better informed cannabis consumers, and that this information that we shared will help you find relief. Until next time, stay well, and we look forward to seeing you next time.